I want to talk about growing a startup. So there's two stories this week. One is Xealth just raised another $24 million to expand their digital health services. And Xealth, great company. And we've had their CEO on the show as well. Great conversation. And we also have fast growing Cincinnati startup celebrates exit following acquisition by Texas-based firm. And so that is Halo Health. Let me hit the story real quick. They were acquired by, is it Hire Simpler? SYMPLR. So they're bringing all those technologies together. And it's interesting to me as I was reading this, and the conversation I wanted to have with you is growth strategies. Mm-hmm. So I'm looking at Halo Health, and I've talked to some people around Halo Health. They said, great company, started by a physician. They did a lot of listening to their end user community. And the first iteration was just mediocre at best. And they just kept listening, iterate. They ended up getting a pretty sizable user base, and then found their exit, merged with another company that has complementary products, and they're bringing it in. That's one path. The other path is Xealth, which is, I mean, they also have a good client base, but I'm looking at this, and one of the things that Xealth did early on is they were part of Providence. They were then spun out of Providence, and they really used Providence's investment arm to really get the word out about them. And they have a ton of investors. I'm looking at this investor slide. It's incredible. Providence, Cone Health, Nebraska Medicine, UPMC, Novant, Memorial Care, Christiana Care, Advocate Aurora, who led the last round, Banner Health, Freighter, Stanford Health, Memorial Hermann, Cleveland Clinic, Atrium Health. These are significant health systems. And I'm wondering, if you're doing a startup and you're looking at this, what comes first, clients or the right investor? I mean, how do you think about that?
Well, I think clients, but in healthcare, because you can't fail fast, having the right investor is also really helpful. And I know because they needed to be embedded in Epic, they had to have the right partners. Like, they could not have done what they were doing with the technology if they hadn't been so closely aligned with Providence. It was Providence that gave them their first Epic integration. So if you're talking about like that path, like the only way you can get really anywhere with Epic is to go through the health system. So the question is the health system the investor, or is the health system the customer? The thing to understand is that the investment group in a health system and the people, the clinicians or the IT group or whoever is going to use your stuff may or may not be aligned. So you think that the investors will give you this ticket to get deployed there, and that's not actually true. A lot of them, and it makes sense, right? A lot of them are like, yeah, we think this is a good investment, but our clinicians have to buy in on their own. So sometimes it doesn't actually get you anywhere, and you have to know that. And I've also had situations where we're talking to the buyer, and then somehow the investment group gets wind of it, and it totally just derails doing the sale. For those healthcare entrepreneurs out there listening, someone gave me some very good advice that I got a little too late because this had already happened, which was, you tell the investment group, you give them a document with warrants, and the warrants are for them hitting certain milestones of deployment. And maybe it's a warrant for deploying, maybe it's a warrant for Epic integration, maybe it's a warrant for doing a case study, and you give them options or stock or whatever, however you want to do it for hitting those warrants. They still are a customer, but then they've actually got this momentum to deploy. And then at that point, you can take, if they want to invest as an investor, you can do that. The problem I ran into was they want to come in as an investor, and then the people who are wanting to spend the money with you want to wait and see if you're going to get a better deal. If they don't have to pay for it if they invest, and then suddenly everything gets derailed. So it's like, in the beginning, it seems like, wow, this is amazing. We've got this potential client and the potential investor, and it can go in a different direction. There you go.